ഗുഡ് മോർണിംഗ് എല്ലാവർക്കും. ഇന്നത്തെ ബ്രാൻഡൻ മലയാളി സമാജത്തിൻ്റെ 27ാമത്തെ ഡോക്ടർ ലൈവിലേക്ക് സ്വാഗതം. ഇന്ന് നമ്മളോട് ഒരു വെറും ഡോക്ടർ ലൈവ് എന്നുള്ളതിനുപരിയായിട്ട് നമ്മുടെ തന്നെ കുടുംബത്തിൽപ്പെട്ട, നമ്മുടെ തന്നെ കൂട്ടത്തിൽപ്പെട്ട മാതാപിതാക്കൾക്കും യുവാക്കൾക്കും ഒക്കെ മാതൃകയാക്കാവുന്ന ഒരു വ്യക്തിത്വം ഡോക്ടർ ജോബിൻ വർഗീസ് ആണ് ഇന്നത്തെ പ്രഭാഷണം എടുക്കുക എന്നുള്ളത് ഒരു പ്രത്യേകതയാണ്. നമ്മുടെ കൂട്ടത്തിൽ ഇവിടെ തന്നെ ജനിച്ചു വളർന്ന് നമ്മളിൽ ഒരാളായിട്ട്, നമ്മുടെ കുട്ടികളിൽ ഒരാളായിട്ട് തന്നെ വളർന്ന് പഠനത്തിൽ വളരെയേറെ ശ്രദ്ധിച്ച് ആത്മീയ കാര്യങ്ങളിലൊക്കെ ശ്രദ്ധിച്ച് വളരെ നല്ല രീതിയിൽ സമൂഹത്തിന് മൊത്തമായി മാതൃകയായി തീർന്ന ശ്രീ ജോബിൻ വർഗീസിനെ അദ്ദേഹത്തിൻ്റെ ക്ലാസ് എടുക്കുന്നതിന് മുമ്പായിട്ട് തന്നെ ഒന്ന് ആദരിക്കുവാനായിട്ട് ഞാൻ ഈ അവസരം ഉപയോഗിക്കുകയാണ്. ഇത് നമ്മുടെ കുട്ടികൾക്കും വളർന്നു വരുന്ന കുട്ടികൾക്കും ഇവരുടെ മാതാപിതാക്കൾക്കും എല്ലാം ഡോക്ടർ ജോബിൻ ഒരു മാതൃകയായി തീരട്ടെ എന്ന് ഞാൻ ആദ്യമായിട്ട് ആശംസിക്കുകയും പ്രാർത്ഥിക്കുകയും ചെയ്യുകയാണ്. ഒപ്പം ബ്രാൻഡൻ മലയാളി സമാജം വളരെയേറെ അഭിമാനത്തോടുകൂടിയാണ് ജോബിൻ്റെ ക്ലാസ് ഇന്ന് ശ്രവിക്കാനിരിക്കുന്നത്. കാരണം നമ്മുടെ വീട്ടിൽപ്പെട്ട നമ്മുടെ തന്നെ ഒരാൾ നമ്മളോട് നമുക്കറിയാൻ പറ്റാത്ത കാര്യങ്ങൾ പറഞ്ഞു തരുമ്പോൾ കുറച്ചേറെ കംഫോർട്ടുണ്ട് നമുക്ക് കേൾക്കാൻ, ചോദിക്കാനായാലും നമുക്ക് കുറച്ചേറെ ഇതുണ്ട്. അങ്ങനെയുള്ള ഈ ദിവസത്തിൽ ഒരു വളരെ പ്രത്യേകമുള്ള ദിവസമാണെന്നുള്ള ആദ്യ ആഗമനമാണ്. അടുത്തതായിട്ട് എനിക്ക് നമ്മളെ സൂചിപ്പിക്കാനുള്ളത് നമ്മുടെ ബഹുമാനപ്പെട്ട അച്ഛനെ പറ്റിയാണ്. അച്ഛനെ നിങ്ങൾക്ക് എല്ലാവർക്കും അറിയാം, ഇവിടെ സെൻറ് മേരീസ് പള്ളിയിലെ അച്ഛനാണ്. നമ്മുടെ കാര്യങ്ങളൊക്കെ നമ്മോട് ഇതുവരെ ഒന്നും നമ്മൾ മുന്നോട്ട് സഹകരിപ്പിക്കാനുള്ള സാഹചര്യങ്ങളൊന്നും ഉണ്ടായില്ല. അച്ഛനെ കാണുന്നത് തന്നെ ആദ്യമായിട്ടാണ് സംസാരിക്കുന്നത്. ഫാദർ എൽദോസ് കക്കാടൻ എന്നാണ് അച്ഛൻ്റെ പേര്. ഇവിടുത്തെ സെൻറ് മേരീസ് പള്ളിയിൽ വികാരിയാണ്. നാട്ടിൽ കോലാഞ്ചേരിയാണ് വീട്. ഞങ്ങൾ തന്നെ 1 മിനിറ്റ് സംസാരിച്ചത്രേ ഉള്ളൂ. അപ്പം അച്ഛൻ്റെ സമൂഹത്തിലുള്ള സാന്നിധ്യം തുറന്ന് ഉണ്ടാകുമെന്ന, പൊതുസമൂഹത്തിൽ ഉള്ള സാന്നിധ്യം തുറന്ന് ഉണ്ടാകുമെന്നുള്ള പ്രതീക്ഷയുണ്ട്, വിശ്വസിക്കുന്നു. പിന്നീട് വന്നിരിക്കുന്ന മറ്റ് പ്രമുഖരായ എല്ലാവരും ഉണ്ട്. പ്രത്യേകിച്ച് പന്നജാനൊക്കെ പറയുമ്പോൾ നമുക്ക് ബലമാണ്. ഏത് പരിപാടിക്കും, വള്ളംകളിയായാലും കാര്യമായാലും ബിജു എന്ന് ഫോൺ വിളിച്ചാൽ പോലും നമുക്ക് വളരെ ബലം നൽകുന്ന പന്നജാന്, അതുപോലെ മറ്റ് ഒരുപാട് ആളുകളുണ്ട്, എല്ലാവരും കാണുന്നില്ല. അപ്പം വന്ന എല്ലാവർക്കും ഉള്ള പ്രത്യേക, ഇവിടെ വന്നു ചേർന്നിട്ടുള്ള എല്ലാവർക്കും ഉള്ള പ്രത്യേക നന്ദി ആദ്യം ഞാൻ അറിയിക്കുകയാണ്. സ്വാഗത പ്രസംഗത്തിനായിട്ട് സമാജത്തിൻ്റെ കമ്മിറ്റി മെമ്പറും ട്രഷറുമായ ശ്രീ ഷിബു ചെറിയാനെ ആദരപൂർവ്വം ക്ഷണിച്ചുകൊള്ളും.
Thank you, Gurinji. Good morning, everyone. I welcome you all to the 27th episode of Dr. Live program organized by Brandon Malayali Samajam. ഈ ഡോക്ടർ ലൈവ് പ്രോഗ്രാമിലൂടെ BMSനെ പല പ്രഗത്ഭരായ വ്യക്തികളെ കനേഡിയൻ മലയാളി സമൂഹത്തിന് പരിചയപ്പെടുത്തുവാനും, അതേപോലെ ലോകത്തിന്റെ വിവിധ ഭാഗങ്ങളിൽ നിന്നുള്ള പ്രസിദ്ധരായ ഡോക്ടേഴ്സിനെ പല വിഷയങ്ങളിൽ നമുക്ക് വിവിധ വിഷയങ്ങളിൽ നമുക്ക് സെഷൻസ് എടുക്കുവാനും അവസരമുണ്ടായി. ഈ പാൻഡമിക് ടൈമിൽ മലയാളികൾക്ക് വളരെയേറെ പ്രയോജനകരമായ ഒരു ഇനിഷ്യേറ്റീവാണ് ശ്രീ കുര്യൻ പ്രക്കാനത്തിന്റെ നേതൃത്വത്തിൽ ബ്രാൻഡൻ മലയാളി സമാജം ഇപ്പോൾ നടത്തിക്കൊണ്ടിരിക്കുന്നത്. ഇന്നത്തെ ഈ ഡോക്ടർ ലൈവ് പ്രോഗ്രാമിന്റെ ടോപ്പിക്കായ മെമ്മറി ലോസ് ആൻഡ് ഏജിങ് നമ്മുടെ ഒക്കെ ലൈഫിൽ സംഭവിക്കാവുന്നതും സംഭവിച്ചുകൊണ്ടിരിക്കുന്നതുമായ ഒരു ആരോഗ്യ പ്രശ്നമാണ്. ഈ സബ്ജക്റ്റിൽ നമുക്ക് ഇന്ന് സെഷൻ എടുക്കുവാൻ വേണ്ടി ഇവിടെ എത്തിയിരിക്കുന്നത് ഡോക്ടർ ജോബിൻ വർഗീസ് ആണ്. നമുക്ക് വളരെയേറെ ഫെമിലിയർ ആയിട്ടുള്ള ഡോക്ടറാണ്. അതേപോലെ നമ്മുടെ ഒരു ഫാമിലി മെമ്പറും മലയാളി കമ്മ്യൂണിറ്റിക്ക് അഭിമാനകരമായ രീതിയിൽ വർക്ക് ചെയ്യുന്ന ഡോക്ടറാണ്. കൂടാതെ നമ്മുടെ BMS ഫാമിലിയിലെ എക്സിക്യൂട്ടീവ് മെമ്പറായ ശ്രീ ജോർജ് വർഗീസ്, ജോമോൻ അങ്കിളിന്റെ മകൻ കൂടിയാണ്. ഡോക്ടർ ജോബിൻ is a family physician at Queen Square Family Health Team. He has special interest in elderly care and palliative care. He's also serving as a medical director and attending physician at Holland Christian Homes. He's also a board director at the Ontario College of Family Physicians. Also, he's a lecturer at University of Toronto. I'm just stopping here. So I wholeheartedly welcome Dr. Jobin to this episode of Dr. Live program.
Thank you very much, Uncle. And thank you, Korean Uncle, and to the entire group from the Brampton Malayalam for inviting me to the... Can you hear me okay?
Yeah, Doctor, I mean, I'll be continuing this.
The chance will coming now.
Yeah.
Thank you.
Yeah. Okay. So, അതേപോലെ ഇന്നത്തെ നമുക്ക് ചീഫ് ഗസ്റ്റ് ആയി എത്തിയിരിക്കുന്നത് ഫാദർ എൽദോസ് കക്കാടനാണ്. അച്ഛൻ ജോർജ് ടൗണിലുള്ള സെന്റ് ജോർജ് സിറിയക് ഓർത്തഡോക്സ് ചർച്ചിന്റെ വികാരിയാണ്. അച്ഛൻ ബ്രാംപ്ടൺ നിവാസിയും കൂടിയാണ്. അച്ഛൻ കാനഡയിൽ വന്നിട്ട് 2 വർഷമായിട്ടുള്ളൂ എങ്കിലും എല്ലാവർക്കും വളരെ പ്രിയങ്കരനും നമ്മുടെ കമ്മ്യൂണിറ്റിയിൽ വളരെയേറെ ആക്റ്റീവും ആയ അച്ഛനാണ്. അച്ഛനെ ഈ പ്രോഗ്രാമിലേക്ക് ഞാൻ ഹാർദവമായി സ്വാഗതം ചെയ്യുന്നു. അതുപോലെ ഇന്നത്തെ ഈ ഡോക്ടർ ലൈവ് പ്രോഗ്രാം സൂമിലൂടെയും ഫേസ്ബുക്കിലൂടെയും വ്യൂ ചെയ്തുകൊണ്ടിരിക്കുന്ന എല്ലാവരും, പ്രത്യേകിച്ച് വളരെ ഫെമിലിയർ ഫേസ് ആയ ഒരുപാട് ആൾക്കാർ ഇന്നുണ്ട്. ഇങ്ങനെ എല്ലാവരെയും ഞാൻ ഒരിക്കൽ കൂടി ഹാർദമായി സ്വാഗതം ചെയ്യുന്നു. അതേപോലെ BMSന്റെ ഈ ഡോക്ടർ ലൈവ് പ്രോഗ്രാമിന്റെ സംഘാടകരായ പ്രസിഡന്റ് ശ്രീ കുര്യൻ പ്രക്കാനത്തിന്റെ നേതൃത്വത്തിലുള്ള എല്ലാ കമ്മിറ്റി മെമ്പേഴ്സിനെയും ഹാർദവമായി സ്വാഗതം ചെയ്തുകൊണ്ട് ഞാൻ എൻ്റെ വാക്കുകൾ അവസാനിപ്പിക്കുന്നു. താങ്ക് യു.
താങ്ക് യു ഷിബു. അടുത്തതായിട്ട് നമ്മുടെ ബഹുമാനപ്പെട്ട അതിഥി അച്ഛൻ ശ്രീ എൽദോസ് അച്ഛനെ ഇന്നത്തെ ആശംസാ പ്രസംഗത്തിനായിട്ട് ക്ഷണിച്ചോളൂ.
എല്ലാവർക്കും നമസ്കാരം. വളരെ സന്തോഷമുണ്ട് ഇപ്രകാരം നമ്മുടെ ഒരു മലയാളി കമ്മ്യൂണിറ്റിയുടെ ബ്രാംപ്ടൺ മലയാളി സമാജത്തിന്റെ ഒരു മീറ്റിംഗിൽ ആദ്യമായിട്ടാണ് പങ്കെടുക്കുന്നത്. തീർച്ചയായിട്ടും ഒരു മലയാളി കമ്മ്യൂണിറ്റി എന്ന നിലയിൽ നമുക്ക് ഒരുമിച്ചായിരിക്കാനും നമ്മുടെ സാംസ്കാരിക തനിമ ഒരിക്കലും നിലനിർത്തിക്കൊണ്ട് ഒരുമിച്ച് നമ്മുടെ കാര്യങ്ങൾ പങ്കുവയ്ക്കാനൊക്കെ സാധിക്കുന്ന ഒരു വേദി തീർച്ചയായിട്ടും ഇവിടെ ഉണ്ടെന്നുള്ളത് അറിഞ്ഞതിൽ തീർച്ചയായിട്ടും സന്തോഷമുണ്ട്. ഞാൻ മലയാളി സമാജത്തെ പറ്റി കേട്ടിട്ടുണ്ടായിരുന്നു, പക്ഷെ കൂടുതൽ അടുത്തറിയുവാനും ഒക്കെ സാഹചര്യം സമയമൊന്നും കിട്ടിയില്ല. കാരണം 2 വർഷമായി വന്നിട്ട് അതിനിടയിൽ 1 വർഷം കംപ്ലീറ്റ് ഈ ഒരു പാൻഡമിക്കിന്റെ സമയത്തിലൂടെ കടന്നു പോയതുകൊണ്ട് നമുക്ക് ഗ്യാദർ ചെയ്യാനോ ഒരു സാഹചര്യം ഒന്നും ഉണ്ടായില്ല. എനിവേ കഴിഞ്ഞ ദിവസങ്ങളാണ് കൂടുതലായിട്ടും മലയാളി സമാജത്തെ പറ്റി അറിയുവാനും ഒക്കെ ശ്രമിച്ചത്. ഇപ്രകാരം ഒരു മീറ്റിംഗിൽ ഇൻവൈറ്റ് ചെയ്തതിൽ തീർച്ചയായിട്ടും സന്തോഷമുണ്ട്. അപ്പം എനിക്കൊന്ന് നമ്മുടെ 27ാമത്തെ ഒരു ഡോക്ടർ ലൈവ് പ്രോഗ്രാമാണ് ഇന്നോട് കണ്ടക്ട് ചെയ്യുന്നത്. അല്ലേ? 27 അല്ലേ? 27. ഞാനിപ്പം മലയാളി സമാജത്തിന്റെ ഒന്ന് ഓടിച്ചെന്ന് രാവിലെ അതിന്റെ പ്രവർത്തനങ്ങളെ പറ്റി ഒന്ന് അറിയാനായിട്ടൊന്ന് സെർച്ച് ചെയ്തപ്പോ ഒരുപാട് സാമൂഹിക നന്മയിൽ അധിഷ്ഠിതമായ പ്രവർത്തനം കാഴ്ചവെക്കാനായിട്ട് പ്രിയപ്പെട്ട അതുപോലെ ഷിബു 2 ഷിബു ഉണ്ട് അല്ലേ, നേതൃത്വം കൊടുക്കുന്ന ഷിബു കുര്യൻസ് അല്ലേ. അപ്പൊ അവരുടെയൊക്കെ നേതൃത്വത്തിൽ വളരെ ഭംഗിയായിട്ടുള്ള ഒരു കമ്മിറ്റി ഫോം ചെയ്ത് നടക്കുന്നുണ്ടെന്നുള്ളത്, പ്രത്യേകിച്ച് നമ്മുടെ മലയാള തനിമ നിർത്തിക്കൊണ്ടുള്ളതായ കനേഡിയൻ നെഹ്റു ട്രോഫി വള്ളംകളിയൊക്കെ കണ്ടക്ട് ചെയ്യുന്നു. അതുപോലെ ഹെൽപ്പിംഗ് ഹാൻഡ് എന്ന് പറയുന്ന ആ ഒരു ചാരിറ്റി പ്രോഗ്രാം കണ്ടക്ട് ചെയ്യുന്നു. ഞാനത് വായിച്ചറിയുവാനായിട്ട് സാധിച്ചു. ഒത്തിരി സന്തോഷമുണ്ട്. കാരണം പലയിടത്തും പല പ്രവർത്തനങ്ങളും ഒരു അസോസിയേഷൻ ഫോം ചെയ്തു, അല്ലെങ്കിൽ വെറുതെ പേരിന് മാത്രമായിട്ട് പലയിടത്തും ഫോം ചെയ്യുമ്പോൾ നമ്മൾ ഇപ്രകാരം ജനനന്മയിൽ ഒന്നി അല്ലെങ്കിൽ മറ്റുള്ള നമ്മുടെ സാംസ്കാരിക തനിമയെ കീപ്പ് ചെയ്യുന്നതായിരിക്കുന്ന പ്രവർത്തനങ്ങൾ കാഴ്ചവെക്കുന്ന തീർച്ചയായിട്ടും അത് അഭിനന്ദനാർഹമാണ്. നേതൃത്വം കൊടുക്കുന്ന എല്ലാവരെയും പ്രിയപ്പെട്ട കുര്യൻ പ്രക്കാരൻ അതുപോലെ 2 ഷിബു കുര്യൻസ് ഉണ്ട്, അവരും അതിന്റെ കമ്മിറ്റി മെമ്പേഴ്സ് എല്ലാവരും പ്രത്യേകം അപ്രീഷിയേറ്റ് ചെയ്യുന്നു. ഞാൻ ഇനിയുള്ള നാളുകൾ കൂടുതൽ അടുത്തറിയുവാനും നിങ്ങളോടൊപ്പം പ്രവർത്തിക്കുവാനും ഒക്കെ സാധ്യതകൾ ഉണ്ടാവട്ടെ എന്ന് പ്രാർത്ഥിക്കുകയാണ്. ഇന്നത്തെ ക്ലാസ് നമ്മളൊക്കെ വെയിറ്റ് ചെയ്യുന്നത് പ്രിയപ്പെട്ട ഡോക്ടർ ജോബിന്റെ ക്ലാസ് ആണ്, ഏജിങ് ആൻഡ് മെമ്മറി ലോസ്. ഞാൻ എനിക്ക് തോന്നുന്നത് കൂടുതലായിട്ട് ഒരു പ്രീസ്റ്റ് എന്ന നിലയിൽ പലപ്പോഴും നാട്ടിലൊക്കെയാണ് കൂടുതൽ അത് എക്സ്പീരിയൻസ് ആയിട്ടുള്ള പല സ്ഥലങ്ങളിലും ഹോസ്പിറ്റൽ മിനിസ്ട്രി ആയിട്ട് വിസിറ്റ് ചെയ്യുമ്പോഴും അതുപോലെ മറ്റ് ഏജിങ് ആയിട്ടുള്ള ആൾക്കാരുമായിട്ട് മിങ്കിൾ ചെയ്യുമ്പോഴൊക്കെ അവരുടെ കൂടുതൽ പ്രയാസങ്ങൾ അതുപോലെ മെമ്മറി ലോസ് ഒക്കെ എക്സ്പീരിയൻസ് ചെയ്യാൻ സാധിച്ചിട്ടുണ്ട്. മാത്രമല്ല എന്റെ പിതാവ്, എന്റെ ഫാദർ, അദ്ദേഹം ഒരു ഡിമെൻഷ്യ അഫക്റ്റഡ് ആയിട്ടാണ് അദ്ദേഹം ലോകത്തുള്ള യാത്ര പറഞ്ഞത്. അപ്പോൾ 1.5 വർഷം അദ്ദേഹത്തിന്റെ ആ ഒരു ഓർമ്മക്കുറവിൽ ഏജിങ്ങിൽ അദ്ദേഹത്തെ ശുശ്രൂഷിക്കുവാൻ കെയർ ചെയ്യുവാനൊക്കെ എനിക്ക് സാധിച്ചപ്പോഴോ എന്താണ് ഒരു ഏജിങ് ഒരു പേഷ്യന്റ് അനുഭവിക്കുന്നതായ സഫറിങ്സ് അത് ഉൾക്കൊള്ളാൻ എനിക്ക് സാധിക്കുന്നു. കഴിഞ്ഞ ദിവസം ഞാനൊരു കനേഡിയൻ ഡോക്ടറുടെ എവിടെയാണെന്ന് ഒരു ഇതിൽ വായിക്കുവാനിടയായി. ഏജിങ് ഒരിക്കലും നമ്മുടെ അതൊരു പ്രോസസ് അല്ല, ഒരിക്കലും നമ്മളെ പ്രായം തളർത്തുന്നില്ല. നമ്മുടെ മനസ്സാണ് പലപ്പോഴും നമ്മളെ എന്താണ് പ്രായമായി തോന്നിക്കുന്നത് എന്നൊക്കെ ഒരു മെസ്സേജ് കാണുമായിട്ടുണ്ട്. എനിക്ക് തോന്നി നല്ലൊരു മെസ്സേജ് ആയിരുന്നു. ഡോക്ടറിലൂടെ നമുക്ക് കിട്ടുന്ന മെസ്സേജ് അപ്രകാരം തന്നെ ആയിരിക്കും ഞാൻ വിശ്വസിക്കുന്നത്. എനിവേ അതേപറ്റി കൂടുതലായിട്ട് അൾഷിമേർ ആയിട്ടുള്ള ആളുകളെ പറ്റി, ഡിമെൻഷ്യ ബാധിച്ച ആളുകളുടെ കൂടുതൽ കാര്യങ്ങളൊക്കെ അറിയുവാൻ ഞാനത് വളരെ കൗതുകത്തോടാണ് നോക്കിയിരിക്കുന്നത്. ഞാൻ ഓർമ്മപ്പെടുത്തിയ 2 ദേവാലയത്തിന്റെ ചുമതല വഹിക്കുന്നുണ്ട്. ഒന്ന് സെയിന്റ് ജോർജ് ചെറിയ യാക്കോബൻ ചർച്ചിന്റെ, അത് നോർമലിൽ പുതിയൊരു പള്ളി അവിടെ വാങ്ങി. ഇപ്പോ നമ്മുടെ ബ്രാംപ്ടൺ ബോർഡറിലാണ്. നേരത്തെ സ്റ്റീൽസ് എയർപോർട്ടിലായിരുന്നു. അവിടുത്തെ ദേവാലയത്തിന്റെ ചുമതല വഹിക്കുന്നു. ഒപ്പം റീസെന്റ് ജേക്കബൻ ചർച്ചിന് ഫോം ചെയ്തതായ സെയിന്റ് ജോൺസ് സിറിയക് ഓർത്തഡോക്സ് ചർച്ച്, അതിന്റെ ചുമതല കൂടി അഡീഷണൽ ഈ കഴിഞ്ഞ ഡിസംബർ മുതൽ അത് കൂടി വഹിക്കുന്നു. അപ്പൊ 2 ദേവാലയങ്ങളുടെ ചുമതലയാണ് ഇപ്പോ വഹിക്കുന്നത്. നിങ്ങളെ ദേവാലയങ്ങളെ ഓർത്ത് പ്രാർത്ഥിക്കുന്ന 2 ദേവാലയങ്ങളെ പ്രതി മലയാളി സമാജത്തിന് ഹൃദയംഗമായിരിക്കുന്ന നന്മകൾ, ആശംസകൾ ഇന്നത്തെ മീറ്റിംഗിൽ നേരുന്നു. എന്നെ ഇൻവൈറ്റ് ചെയ്യുന്ന പ്രത്യേക സന്തോഷം. എല്ലാ ഇതിലെ അംഗങ്ങളായിരിക്കുന്ന ഞാൻ പാർട്ടിസിപ്പൻസ് നോക്കി 38 പേര്. നല്ലൊരു ഗ്യാതറിംഗ് ആണ്. കാരണം ഞാനിതുപോലെ ഒരുപാട് മീറ്റിങ്ങുകളൊക്കെ എന്തെങ്കിലും പള്ളിപരമായി കണ്ടക്ട് ചെയ്യുമ്പോൾ ആളുകളുടെ പാർട്ടിസിപ്പൻസ് പരമാവധി ഉണ്ടാവാൻ പരിശ്രമിക്കാറുണ്ട്. ഞാനിപ്പോൾ ഒരു സ്റ്റുഡന്റ് കൂടിയാണ് ഇവിടെ CSW കമ്മ്യൂണിറ്റി സർവീസ് വർക്ക് സ്റ്റുഡന്റ് കൂടിയാണ്. കഴിഞ്ഞ ആഴ്ച ഞാൻ ഉൾപ്പെടുന്നതായ എന്റെ ഒരു പ്രോഗ്രാം കൂടി ഞാൻ ഒരു സെഷൻ കൈകാര്യം ചെയ്തിരുന്നു കനേഡിയൻ ലോ സംബന്ധിച്ച്. അപ്പോ ഞാൻ എന്റെ ഫ്രണ്ട് കൂടിയാണ് ആ ക്ലാസ് കൈകാര്യം ചെയ്തത്. അപ്പൊ അതിനകത്ത് ഇങ്ങനെ ആളുകളുടെ എണ്ണം കൂട്ടുവാൻ വേണ്ടി പരിശ്രമിച്ചു. അപ്പൊ ഏകദേശം ഒരു 72ഓളം മെമ്പേഴ്സ് അത് ജോയിൻ ചെയ്തപ്പോ ഞാനത് ഓർക്കുന്നു. അതിന്റെ പിന്നിൽ നമ്മൾ പരിശ്രമിക്കുമ്പോൾ തീർച്ചയായിട്ടും ഇന്ന് അതിന്റെ പ്രവർത്തനം പരിശ്രമിച്ചപ്പോൾ 43 ഇനിയും കൂടുമെന്ന് പ്രതീക്ഷിക്കുന്നു. തീർച്ചയായിട്ടും നല്ലൊരു സൈനാണ്. ഈ സാറ്റർഡേ ഒരു ഓൾമോസ്റ്റ് എല്ലാവരും റിലാക്സ് ചെയ്യുന്ന, അല്ലെങ്കിൽ വീക്കെൻഡ് നമുക്ക് ലോ വീക്കെൻഡ് ആണ്, എല്ലാവരും റിലാക്സ് ചെയ്യാൻ കാത്തിരിക്കുന്നു. ഇപ്പോൾ ഇത്രയും ആളുകൾ ജോയിൻ ചെയ്യുമ്പോൾ നമ്മുടെ കൂട്ടായ്മ ഫെലോഷിപ്പ് തീർച്ചയായിട്ടും അത് എക്സ്പോസ് ചെയ്യുന്നു. ഒരിക്കൽ കൂടെ എല്ലാ നന്മകളും ആശംസകൾ നേർന്നുകൊണ്ട് വാക്കുകൾ ഉപസംഹരിക്കുന്നു. ഞാൻ ആദ്യാവസാനം ഈ മീറ്റിംഗ് ഉണ്ടാവും. എല്ലാവരും ഈ പാൻഡമിക്കിന്റെ സമയത്തിൽ സേഫ് ആയിരിക്കട്ടെ എന്ന് മാത്രം പ്രാർത്ഥിച്ചുകൊണ്ട് എല്ലാ നന്മകളും ആശംസിക്കുന്നു. ഗോഡ് ബ്ലെസ് യു. താങ്ക് യു.
താങ്ക് യു അച്ഛാ. അടുത്തത് നമ്മുടെ പ്രിയങ്കരനായ ഡോക്ടർ, നമ്മുടെ സ്വന്തം ഡോക്ടർ, നമ്മുടെ കുടുംബത്തിന്റെ അംഗം ശ്രീ ജോബിൻ വർഗീസ്, ഡോക്ടർ ജോബിൻ വർഗീസ്. സ്നേഹപൂർവ്വം invite you for your classes.
Thank you so much, Guri Uncle. Thank you for inviting me, and thank you, Achin and Shibu Uncle, for the introduction. The talk itself is going to be on memory loss and aging, as has been said, and the name I've given it is "Where Are My Glasses?" As has been said a few times, I've been in Brampton and Mississauga most of my life. And initially I was known as Joan and Annie's son and Jeevan's brother, as well as lately as Rena's brother-in-law and godfather and uncle to Jace. I'm Liz's husband, Leora's father. I'm a long-standing Brampton Samajam picnic goer, one-time dragon boat racer. As been said, I've been working in Brampton since 2010. As a family physician, working in long-term care as well. I train family medicine residents through McMaster University, and I teach out of University of Toronto as well. Before we jump into memory loss and dementia, I wanted to review some normal changes that occur in aging, as I hear often people wondering about, is what's happening to me normal or not? So it's really important that people understand that when you walk into a room or walk into the pantry and you say, why am I here? That can happen at any age. And a lot of times it's due to concentration than it is memory loss. And so the major difference between when something jumps from being normal aging issues as opposed to a potential for dementia is when it starts affecting your function. We know that somebody who has an issue with forgetting names every now and then, but then later remembering it, is part of normal aging. While somebody who has familiar names or familiar people and they start forgetting those sort of things, that's actually something that'll start affecting your function, whether it's at home, whether it's at work or at school. It's something that can really affect things altogether. And so we usually start talking about function as a major reason for why something would be outside of normal versus why it's in dementia or memory loss. When we talk about normal changes, we typically see increased fat, decreased muscle, less strength in the bones, a lot more graying hair, trouble with vision and hearing, both of which are extremely important to help with the best brain health. I also wanted to touch a little bit on brain anatomy, and I won't go too in depth, but I think it is important to be able to understand the lobes of the brain and how that can affect memory and function. When we talk about the frontal lobe, the red area, that has a lot to do with our ability to problem solve, as well as our ability to have reasoning and judgment. We do a lot of our function through our frontal lobe. So if that gets affected, much of the time our ability to do things gets affected because we're not able to functionally move our body in the way we want to, or we're not able to have typical problem solving skills. If we talk about the parietal lobe, the yellow lobe, it's all about knowing left from right, as well as being able to read and know where our body is at any one time. In terms of the blue or the temporal lobe, this is extremely important with regards to our ability to maintain our behavior, to have a ability to have a social filter. And when we lose this area, much of the time it can affect our language or it can affect our behavior. The green area, the occipital lobe, is all about vision and color. And then we'll hear about balance in inner ear issues. People may know about vertigo, but when we talk about the actual epicenter of balance, that has everything to do with the cerebellum. And lastly is the brainstem, which helps us do all the things that we really need to do on a regular basis, but we don't need to think about. And typically that's breathing and digestion and swallowing. Another thing I want to just touch on, because again, it talks to function, is about the instrumental activities of daily living, which include shopping, housekeeping, food preparation, accounting, and driving. And if you lose any of these abilities, you start having an increased difficulty on being independent. It doesn't necessarily affect how you function, but it can affect what sorts of things you can do by yourself and when you start needing help from other people. Versus in activities of daily living, these are the things of how your body works. And so if you get to a position where you're losing these activities of daily living, you start requiring increased care, which then also means that you need a possibility and change in your living arrangements. So what do you think of when you think of the word dementia? It's likely a word you've heard before. Many people equate it with Alzheimer's disease. And some might think of the award-winning Malayalam movie, Tanmatra, in which Mohanlal portrayed a man living with Alzheimer's disease. We're going to speak more about Alzheimer's disease because it's the most common. But as we think through the journey of life, there's an important understanding that we need to have in that some people will inherit the potential for Alzheimer's disease, and others will have very modifiable risk factors, such as smoking or depression or social isolation. There's a lot of conversation right now that the increased social isolation we're having with regards to the necessities of lockdown may actually increase the risk of dementia down the road. We know that dementia is present in 6 to 8% of the population greater than the age of 65, and this doubles every 5 years to a point where over the age of 85, there's about a 45% chance that somebody might have dementia. But I think it's important to understand that dementia is an umbrella term. It covers all of these different types. We hear about Alzheimer's because it's the most common, but there's also other types, and we'll go through them a little bit more in detail. Alzheimer's dementia is typically described as a gradual global decline in function. It can be seen in memory, in physical function, as well as social functioning. It's seen as a shrinking of the brain, and this is usually due to tangles that occur within the brain, something we call neurofibrillary tangles and proteins that become plaques. But also, there's a lack of a neurotransmitter called acetylcholine, which causes a damage to the hippocampus, which is an area of the brain that allows us to cause formation of memory. Other areas can get affected as well, and we see here on this scan that the black area, that ventricles, that central area, while it's quite small and normal, brains, in Alzheimer's, the ventricles get very large, and then as a consequence, the brain shrinks. We also notice that there's a lot of issues with short-term memory. And I like to use this analogy of a snowball. Being in Canada, we're all very familiar with snow, maybe less so this year. But if we think about snowballs, we think about the fact that when we are born and as we grow up, we get a crystallized center about who we are, who our family is, what's important to us, who our friends are, and we slowly over time take fresh snow and kind of pack up our snowball. With dementia, what ends up happening is that snowball gets to a point where we try and put it on top, it just flakes off. And over time, that snowball gets smaller and smaller until even the more base things that we remember and that we hold true to ourselves that we forget. Language skills can worsen as well. Especially people who know multiple languages can actually start reverting to their primary language that they learned when they were a child. It's very rare to see physical symptoms, but we do see this. It's rare to see it early on, but we do see it as time goes on, and we also have certain behavioral symptoms that come as well. As time goes on, things like the worsening cognition can cause problems between families. You can have worsened issues with being able to spatially know your awareness and have more falls. You can also have an issue with being able to have worsening depression, anxiety, and irritability. The other thing that's important is we think about 4 A's: amnesia, memory loss; aphasia, impaired ability to communicate; apraxia, a difficulty in functioning in the physical sense, as well as creating that motor sequence; agnosia, difficulty in taking in information from the senses, whether it's vision, hearing, or smell. We use a 7-point scale to get an idea of where somebody might be, with 1 and 2 being mild, and as you move forward, 6 and 7 being more severe. And these things could be difficulty with mild, where it's difficulty with bouncing checkbooks, to being as severe as being resistant or combative with those that are trying to help us with care. There can even be a love-hate relationship with caregivers, to a point where somebody's extremely dependent on a spouse or an adult child, but they're incredibly unkind. And this has nothing to do with who they are, which makes it even more difficult for family members to cope with this change. There's also, as time goes on, a difficulty in ability to eat, as well as ability to walk or talk. The treatments that we have for Alzheimer's typically are centered around what sort of symptoms are present. We do have certain medications that can target the neurotransmitters that are lacking, or the nerve damage that can occur. And there's some new treatment that is in process right now where it can actually target the neurofibrillary tangles that are the true cause. Moving to vascular, this is usually caused by an event like stroke and can cause high risk in people who have issues like diabetes or blood pressure. Typically, when somebody has Alzheimer's and vascular, we call that mixed dementia, and we're starting to see that has a little bit more of that pie of the puzzle. The issues that can come up with vascular dementia are typically fixed to the area of the brain that's affected, based on those different areas I showed you earlier. Lewy body dementia, or Parkinson's dementia, are a spectrum of disorders that actually affect memory, behavior, sleep, and movement. It's sort of the umbrella term that we use, and it has to do with an abnormal deposit of protein that occurs and builds up within the brain. That increase in buildup actually can affect dopamine, which then causes Parkinsonism features like tremoring, slow movement, and rigidity. These Lewy bodies can also be found in different areas of the brain and affect thinking process, behavior, and perception. There's a major difference between the two, in which Lewy body typically has the dementia first and then the Parkinsonian features after, while Parkinson's disease, people may have the motor functions of the slowing and some of these other things, and years later have the dementia. With Lewy body dementia, one of the other characteristic features is that there can be visual hallucinations, especially kids. And when that comes up, that sometimes is a trigger for us to know where we are. This is usually broken down to a 7-point stage, in which 1 is no cognitive decline or memory loss, and 7 being severe. The next, frontal temporal dementia, is broken down into a couple areas. I'm not going to go heavily into it. It's worthwhile noting that people might have heard this known as Pick's disease because of the person who defined it. But Pick's is more of the behavioral variant type that's on the left, where there's much more social disconduct. And this is usually due to the loss of the social filter because of the effect on both the frontal and the temporal component. In contrast to Alzheimer's dementia, where it's a global effect to the brain, frontal temporal affects the frontal lobe and the temporal lobe. If the temporal lobe is more heavily affected, that's usually when you see the semantic dementia or the progressive non-aphasia, where it affects more of the speech as opposed to the behavior. Young onset Alzheimer's is typically seen when people are under the age of 60. And I mentioned Tanmatra earlier, but also there's an English movie called Still Alice that really does a great job of showing this as well. And I would recommend, if anyone is curious about what it looks like to have young onset Alzheimer's, to consider watching this. It's a hard watch because it's very gut-wrenching, but it is a very good movie. The others can include things like Creutzfeldt-Jakob disease, which people may have heard in the media as mad cow disease, but that's one type, one variant. Mad cow being a contaminated beef that was eaten and caused something called prions to affect the brain. Prions are a protein that we all have in our body, but when they get diseased, they can cause a problem with the getting misshapen and causing infection and harm us. Huntington's dementia is an inherited disease, very rare luckily, but has everything to do with being an inherited disease. If one parent has Huntington's disease, there's a 1 in 2 chance that you can inherit Huntington's disease to the next person. And typically it starts with memory loss and changes in perception, but also can have severe depression, a lack of interest or enthusiasm, and irritability. Interestingly, with Huntington's disease, memory is not affected in the sense of short-term or long-term memory, but procedural memory, the ability to remember how to do things, using a phone, driving a car. These are the areas that get affected. Speaking about the risk factors of dementia, it's probably a no-brainer to think that smoking, alcohol, and physical activity all have an effect. But sometimes people don't realize that mental health like depression or chronic sleep deprivation can have a major effect as well. And part of the reason for that is chronic sleep deprivation can cause an effect on the suprachiasmatic nucleus within the brain. This is basically where our sleep-wake cycle is affected. We all have a certain ability to know when it's time to wake up, know when it's time to go to sleep. That's set by our circadian rhythm. Unfortunately, with Alzheimer's disease, that effect on the suprachiasmatic nucleus can actually cause an effect on our ability to produce melatonin. It can lead to trouble staying asleep, going to sleep, and it can cause problems with behaviors in the family when there's family members who are trying to go to bed so that they can be available for the next morning's work or school, and the patient with dementia is roaming the hallways because they've flipped their days and nights. It's also worth noting about sleep apnea, which is a common situation and regularly undertreated, but it can increase the risk of Alzheimer's dementia. And we think this has to do with the chronic loss of oxygen that occurs throughout the night. Also, people who have even mild concussions can have something called chronic traumatic encephalopathy, or CTE. And this has been seen to be very similar to the effects of Alzheimer's dementia. It's also known that diabetes, cholesterol, and high blood pressure all risk if undertreated. So look after your heart. Keep your blood pressure, cholesterol, diabetes, and weight under control. And this will reduce the impact of vascular dementia in particular. Quitting smoking falls in this category as well because it reduces the neurotoxins that can further damage neurons. It's important to mentally challenge your brain. Use it or lose it. It's important to challenge your brain without frustrating yourself. The more frustration you get in a new task, especially if you're told, go do crosswords or go do Sudoku. If you don't find them challenging, if you find them too frustrating, you won't actually get the benefit of it. So challenge yourself, find something you enjoy. A new language perhaps is a great way. There's also a need to understand that this may not affect memory, but it may help with the executive functions like the decision-making, the reasoning, or that ability to process faster. Being physically active is exceptionally important. I'll speak a little bit more about exercise in a second, but it's known to actually stimulate the brain by producing new neurons and reducing the decline. Increased social activity, and this is epically important right now. That social engagement is extremely important, and it's very important to have that social interaction between others in a meaningful way. Most important in my mind is a healthy diet. There's been plenty of studies that show that a diet full of fruit and vegetables, legumes and nuts, as well as following something like a Mediterranean diet where it's with olive oil, or eating fish twice a week, adding herbs and spices instead of salt, and limiting red meat has been reducing the risk of dementia. There's a clear correlation between processed foods with high fats, or especially trans fats, that have an increased risk of dementia. I commonly get asked about vitamins. So I just wanted to, vitamins and minerals. I wanted to just put a point in here that there's been a few trials that have been done on vitamins A, B, C, D, E, beta carotene, calcium, zinc, copper, folic acid, selenium, omega-3 fatty acids, ginkgo biloba, soy. And in those studies, there's been no clear evidence that supplementing with the different vitamins or minerals significantly improves the prevention of dementia. It's worth noting that things like vitamin C and beta carotene had in low quality studies some small benefit, but I would argue that you can get that in your diet far better than you can in pills. As well, people who are deficient in folic acid or vitamin B12, having those supplemented can improve with memory. But I would say that it's only if you're deficient in it that you should consider supplementation. In the end, food is, I'm a huge part, I fully believe that food should be treated as medicine, and increasing fruits and veggies are helpful, and our parents are right. We should eat our fruits and vegetables. No talk would be complete without speaking about COVID-19. And it's worth mentioning that there has been about a 64% increase in deaths in long-term cares, above the normal 27 to 52% that's usually seen, mainly because people with dementia are twice as likely to contract COVID-19. Interestingly, a study was published on February 9th of this year, and it showed that people with vascular dementia were 3 times more likely. The thought process is it has to do with inflammation of the brain, as well as part of the mobilization of the immune system, causing something called a cytokine storm. But I think it also is worth noting that COVID-19 is neuroinvasive. It does get into the brain. And there's a concept of COVID brain that's currently under research, in which it seems like there's a bit of a brain fog that occurs. And so my biggest advice to everybody is, when available, get the vaccine. I have some resources here for everybody who's interested, especially those that are caring for someone who have dementia. I think it's extremely important that people get involved with support groups, and I'd like to thank Korean Uncle and the entire team from Doctors Live for this time to talk, and welcome questions.
So, Dr. Jobin, can you advise some types of exercises, or apart from being, engaging in Sudokus, crosswords, any other challenging that we can do simply at home? Or
Thank you. Thank you. Yes. So there's a couple of things. I actually just realized that slide may not have come through. I'm going to put up a quick slide just because I think it'll be important to show the different areas you can do something. And specifically, it has to do with the different activities that can be present. When it comes to activity, strength and resistance training is extremely important. When we think about that, sometimes we think that means weights only, but I would argue that body weight exercises, as well as using a resistance band, can be just as effective. There's evidence about Tai Chi being both effective for balance and strength training. And so this can be done through watching videos online and following along, as well as different flexibility exercises like Pilates or yoga. On average, the recommendation is about 150 minutes per week of moderate exercise or 75 minutes per week of vigorous exercise. I highly recommend that at least 10 minutes of continuous exercise should be considered at each stint. And what I mean by that is that exercise is cumulative. It doesn't mean that you have to do all the exercise in a 30-minute or an hour to get the benefit. You can do 10-minute episodes and get the benefit. The best way to think about moderate exercise is that if you're going for your walk, you should have to take a couple of breaths to be able to speak to someone else that you're with if you want to get the best exercise. If you're going for a walk outside and you're not at all struggling to really be able to do that walk, you may not be getting the level of effect you need to get the benefit. And so it could be one of the things I love recommending to my patients is to set up a little bit of an obstacle course within the house. And if you have grandkids, kids that are in the house, maybe have them be your weights. They can kind of hold you back a bit. But the idea is that doing that obstacle course will both work on your balance as well as your flexibility. So whether it's gentle walking, whether it's biking, if possible, when swimming's available, I'm a huge proponent for swimming because of the benefit that your weight eliminated. So people with bad arthritis in the knees or hips, they find that swimming is easier than running or walking. I feel that ellipticals and bikes are a little easier on the knees as compared to treadmills. There are ways that you can run on a treadmill effectively while saving your knees. I hope that answered the question.
Yeah, thank you, doctor. Thank you.
Dr. Jobin, I have a question. Actually, you mentioned somewhere saying that the Parkinson's, that will affect the thinking process, right? Can you please elaborate a little bit more on that?
Sure. As with all dementias, the ability to remember is one part of it. There's also the perception or the idea of what you can do. So with Parkinson's dementia, with really all of the dementias, you increase the chances that people may have a poor safety awareness. And so if somebody is already weakened by any reason, we'll say for Parkinson's for this example, if they're rigid, if they're moving slowly, they may not feel that's the case. And so what may end up happening is they may want to be able to get moving and think they can do it on their own and increase the risk for fall. Also, in Parkinson's disease specifically, you're actually slowed in your movement, but not necessarily always in the mind. So you may think you can do something, but the mind may not be able to send that reaction time to the body to protect you from a fall or to help you remember to use your walker appropriately. It's typically memory, that reaction time, as well as an increased irritability or increased depression symptoms, usually due to the medical issue at hand.
Okay. And what are the initial symptoms before getting to your full?
So it's a little different in every person, unfortunately. So when it comes to Parkinson's dementia, typically, like I mentioned, typically you'll have the motor symptoms first. You'll have the shaking, you'll have the rigid motion, you'll have the slowed movements. And then years later, you'll start having issues with memory, with being able to pay attention to what you're meant to do. If you're taught how to use a walker, if you're taught how to use a cane, and then the dementia kind of kicks in, it could stop that ability of what we call carryover, learning what you need to have done and then carry that over into function. With Lewy body, for example, typically the memory and the behavioral issues will come first, and then over time, the Parkinson's, the motor symptoms will show up after.
Okay, perfect. Thank you so much.
Not a problem. Happy to take more questions.
Yeah, I have a question.
Yes.
It's Susan. Hi, Dr. Jobin. Medications such as, that we take for diabetes, blood pressure, cholesterol, does it have anything to do with dementia?
Very
and
good
also,
question.
secondly, what are the early symptoms of dementia?
Yeah, great question.
I guess there are two. I mean, dementia, I guess there is one kind, but Parkinson's, I believe there are two kinds. One that is related to diabetes as well as a independent of that. I may be wrong. I'm just asking this question.
Yeah, no, thank you, Susan. That's a great question. So let me take a step back then. So there's multiple types of all of these different things. I have to simplify just for time's sake. With specifically with regards to the medications, the typical one you'll hear the most about is the statins. So the Crestor, Lipitor, all those medications. There is when you use these medications for a long period of time, there is an increased chance for dementia seen in neurological studies. However, the benefit of the medication far outweighs the risk. And so if you're on these medications, you're going to have significant benefit if it's done appropriately, but significant benefit over that risk of dementia. Typically, what we say is that whatever effect you're going to get from the statin, you're going to see that effect 10 to 20 years down the road. So the bigger question is whether people need to continue those medications as they get into later stages of life. With regards to the question about diabetes and Parkinson's, there is variants of Parkinson's disease that are tied to different conditions, but many times they get associated as opposed to cause. So with regards to the vascular Parkinson's, which is the one that's tied to diabetes, it's sort of a mixed. I talked about mixed dementia where vascular and Alzheimer's dementia are connected. This is more so that the brain actually has vascular type changes, and that causes those Parkinsonian symptoms without actually having Parkinson's disease. So we talk about as Parkinsonisms. And so it's typically seen in people who have changes in the brain that blood flow doesn't work as well. And that can be caused by blood pressure issues, cholesterol issues, or diabetes.
Okay. Yeah. All right. Thank you so much.
Not a problem. Anytime.
Yeah.
Any other questions?
Hi, can I ask a question?
Of course.
Yeah, sorry, I'm actually not living in Brompton. I'm friends of Sheila Pudukiril and also cousins of Woman Joseph. I just got this link, so I thought that it was a brilliant presentation, Dr. Jobin. I just wanted you to highlight, when people have dementia in the family is another one which suffers a lot, and the carers especially really don't know what to expect. And what kind of advice would you give for families who are going through this, or the carers, if that could be of benefit to someone who is having dementia at home?
Yeah, I think it's a really important thing. My biggest advice is always to jump into the resources as soon as possible. One of my biggest worries whenever I speak to families is that they learn about Alzheimer's too late. And especially regardless of the type of dementia, all types of dementia will have some sort of behavioral change. And so when we think about those behavioral changes, it can affect the family as a whole. I totally agree with you. And I actually think sometimes something I tell families a lot of times is sometimes it's harder to be by the bedside than in the bed. And that idea is that if you have a situation where we know, also I'll use Alzheimer's, for example, that when you get people to moderate dementia, that by far is the hardest time for families because you're too early to have a lot of care and you're too late to really bring in a lot of these prevention. And because the medication till now hasn't really been perfect to improve the disease process, all we can really do is slow down the process or hit a pause button. The different medications we use, they're typically great medications for the drug companies in that you have to be on them. And while you're on them, you get a certain benefit. The second you stop, you lose all that benefit. So in that way, it's great for slowing down disease, but it does nothing to treat the actual disease itself. So a lot of times we talk about symptom control, and that's where a lot of times I highly recommend if there's family members where there's someone else who is really dealing with the disease and you're dealing with the repercussions of it, to talk to people about it, talk to your physicians. There's a caregiver burnout form that we use, which we can help the caregivers with resources and really bringing some level of control, because that's a lot of times the hardest part, is that lack of control causes us to not be able to feel more comfortable in what's happening. That answered your question.
Thank you for
My
that.
pleasure.
Yeah.
Are there any other questions? Yes.
Any questions? Questions on the
If there's no other questions, I'd like to thank Korean Uncle and the entire Brenton Samajam and everybody from around the world, I guess. And thank you, Achin, also for that talk. And
നമുക്ക് നമ്മുടെ വോട്ടത്താങ്സിലേക്ക് കിടക്കാം. അതിന് മുമ്പായിട്ട് ഞങ്ങളൊരു സമാജത്തിന്റെ എന്റർടൈൻ കൺവീനർ ആയിരുന്ന സണ്ണി കുന്നംപള്ളിയുടെ ഫാദറിലോ ഈ കഴിഞ്ഞ ആഴ്ച നാട്ടിൽ മരിച്ചുപോയി. അദ്ദേഹത്തിന്റെ കുടുംബത്തോടുള്ള ആദരാഞ്ജലികൾ ഈ അവസരത്തിൽ അറിയിക്കുന്നു. ഇതോടൊപ്പം നമ്മുടെ സമാജത്തിന്റെ വൈസ് പ്രസിഡന്റ് ശ്രീ ഉമ്മൻ ജോസഫിനെ വോട്ടർ താങ്ക്സിനായി ക്ഷണിച്ചുകൊള്ളു.
Mute on.
Thank you, Kiran. My responsibility is to thank you all for attending today's session. It was a wonderful session. Now I'm thinking whether I remember what Jobin mentioned. So I think I have dementia already, but hope that I can use the slides that in our Facebooks so that we can read and see what he said. Anyway, it was a good presentation. Thank you, Jobin. As on behalf of BMS and also personally, I thank you all for your class, and it was in detail. I don't know whether we all can comprehend what you mentioned, but it was a very good presentation. At least we can go back and we have the resources to see when we all need it. And thank you, and a special thank you from us. You are my mom's doctor, so I know personally. Thank you. And also, as you are doing a lot of things in Brampton, so as a Bramptonian, I thank you for your services. And also, I would like to thank you, Elder Sachin, for his kind words today, and welcoming Achin's more presence in our community efforts. And a special thank you for all who organized this today, especially our technical team, and also President Kuriam Rakayam for organizing this 27th Doctor's Live program. Thank you all for attending today's, watching in Zoom as well as watching in FaceTime. So thank you all for your support giving to the BMS program. Thank you.
Thank you, Saja. നമ്മുടെ ഡോക്ടറെ ആക്ച്വലി 10 മിനിറ്റ് നേരത്തെ അവസാനിച്ചിരിക്കുകയാണ്. ആർക്കെങ്കിലും സംശയങ്ങളുണ്ട് ചോദിക്കാം. 10 മിനിറ്റോളം സമയമുണ്ട്. ജോബിനെ അങ്ങനെ വിട്ടിട്ട് അർത്ഥമില്ല. 10 മിനിറ്റോടെ നമുക്ക് ഇതാണ്. ആർക്കെങ്കിലും എന്തെങ്കിലും ചോദ്യം ഉണ്ടെങ്കിൽ ചോദ്യത്തിന് കുഴപ്പമൊന്നുമില്ല. വോട്ടർ താങ്ക്സ് കഴിഞ്ഞാലും 10 മിനിറ്റ്സ് ഉണ്ട് നമുക്ക്.
Doctor, can I ask one more question? So when people have dementia and this kind of behavioral issues, when you control them, is it going to worsen it, or how should the caregivers approach to them in restraining or controlling or their all their activities?
Yeah, I think that's a great question. Yeah, one thing I would say with that is that I think one of the great kind of approaches to working with somebody who has dementia as a caregiver would be to say that you want to distract and really aim towards having as much sort of not confrontation, right? So one of the things that happens with any dementia is that you get this is what I believe, this is their reality. And when we kind of combat against that, it causes an increased confusion or increased irritability, because it's like, no, this is what I believe. So my advice is always to especially early on, correct without necessarily nagging, and really try and allow for a conversation if it's available. As time goes on, that ability won't be present. So instead, what we want to try and do is aim to just distract. You seem a little bit agitated. Why don't we get something to eat? You know, I have this great new game. I'm going to call up our granddaughter and grandson, and I'm going to go ahead and put them on, and we're going to go through this together, and we'll spend some time kind of doing this. Finding things that are not necessarily going to cause people to get more agitated while still being able to enjoy their quality of life is really that kind of sweet spot. The other thing that I find is difficult, and just to your question, is the medications always are going to be treating a symptom. So unfortunately, with all medications, and so with side effects comes the chances that people may actually worsen, they may improve, they may kind of go anyway. So it's a little hard to say this is the best approach, but my advice is just be honest and open with your physicians when you're working with them, especially the stigma of family sort of discord and how people interact with regards to, you know, maybe they're a little more aggressive. That should be open and honest with physicians so that they can actually target those symptoms instead of trying to hold back and say, oh, well, I don't want them to think that something's wrong at home. It's important that we get some of that stuff in the open, because maybe it's not dementia. Maybe it's what we call pseudo dementia or depression. And so maybe that needs to be treated. Maybe it's that we need to actually focus in on the other things that might be going on. But if as physicians, we don't know, it's that much harder. So that would be my main advice on that.
Okay, thank you. Thank you, Jobin.
Dr. Jobin, I have one more question.
Please.
You mentioned about sleep apnea.
Mm-hmm.
I believe it has an effect on dementia.
Yes, it does.
All right. So my question is this a reversible change, or it can be stabilized by using the CPAP machine?
Yeah, so there's two answers to that question. The first is that with mild symptoms, it could be that the actual mouth guard or something along the lines of a positional changes may be sufficient. You don't always have to jump to CPAP machine. So a CPAP machine is a continuous positive airway pressure machine, and it allows people to actually have the oxygen at all times. It forces the air into the mouth as they sleep through the night. The benefit of that is that if somebody has a certain ratio between the number of times they stop breathing versus the number of times they slow down the breathing, then there's less chance that that oxygen isn't getting to the brain. Well, the benefit of the CPAP is if it's started early enough and used effectively, yes, there seems to be a reduction in the risk of progression to dementia. The problem with the question in general is that a lot of these things are more associations as opposed to cause and effect. And so we know there's an increased risk in some things. We don't necessarily know in all cases what the direct percentages are. So yes, it's true that treating a disease or an issue that's a risk can improve. In this case, if we can get into the point where we're decreasing those decreases in oxygenation, then yes, we can prevent that risk a little bit more. In one of my slides, I show that by reducing all of those different things, whether it's smoking, high blood pressure, all those things, there's about a 5% reduction in all of the modifiable risks. I believe you're on mute.
Hi, Dr. Jobin, I would like to ask a question.
Please.
Are there any clinical tests available right now so that we can detect any possibility of having dementia, and that will help us to take some precautionary measures, right?
Yeah, you know, I would caution against some of the idea of because there's some people who actually are born with this, there's a lot of different things that can be done. So some people are getting genetic testing and then seeing they have an increased risk because of the gene presence. But just because you have a gene presence doesn't necessarily mean you'll get the disease. The other side is there are clinical tests that physicians or nurse practitioners to healthcare providers in general can offer, whether it's a mini mental status exam or the Montreal Cognitive Assessment. But these tests in isolation are not useful. What's better than trying to kind of do this at home would be the idea of, if there's something you're worried about, speak to your physician. There's some generalized screening that they can do, and then work on all these things that you can control. You don't necessarily need a physician or a healthcare provider to work on on your diet, work on improving your fruits and veggies and not smoking, decreasing alcohol. So I would say control the things you can control. And then when you do find that there's a worry, bring it up. I think there's a higher chance it can be more individualized. It's not something that can be too broadly said, this is the way to do it, mainly because there's certain conditions where if you are delaying it, it can cause catastrophic issues. I mentioned Huntington's and CJD. They have very short timelines. Even young onset Alzheimer's, typically people go from diagnosis to death within 2 to 3 years. So if you're worried, it's always better to bring it up and then have those initial tests done and have them assessed in an appropriate way. Many times early on, there isn't a clear answer. And this is why it makes it much more difficult to say, this is what you need to do. But you can do the more risk factor control. Exercise, especially that cardiovascular exercise we talked about. Have a healthy diet. Decrease any of the vices that can make things worse. Work on the weight. And I highly recommend the Mediterranean diet, which I had mentioned before, where you're changing your fats to more polyunsaturated fats or things that are like the olive oil, and having more fish in the diet and less red meat.
One
I know
more question.
it's probably strange to hear a doctor say don't use medications, but I think this is one situation where I've seen more harm. I'm much more of a minimalist when it comes to it because of it. Yes, Auntie, go ahead.
One more question is that, is there a prevalence in Alzheimer's in certain certain group of people, like say diabetes in most seen in South Asians?
Yeah.
So is there any practices what we use, like, because aluminum vessels and aluminum was one of the causes that I heard of causing, I don't know about the studies, and if you can
so that hasn't been totally borne out. Yeah, it hasn't been totally borne out in large scale studies. So just to answer the first part of your question, the issue with saying one population is higher risk than others is that the South Asian population is smaller than other population. And so because we have a higher risk for diabetes, for high blood pressure, high cholesterol, our risk increases, but we're not going to see those in the studies because of the fact that we're a smaller percentage of all the people that get looked at. When we look specifically at South Asians, it's usually South Asians with these different risk factors. The one thing that's kind of interesting is we don't see a lot of the gene, so this inherited side, in our South Asian population. So in Indians themselves, we don't see a high percentage of people that have the apolipoprotein E4. So that's actually a good thing, means that genetically we don't have that predisposition, but we do unfortunately have the predisposition for diabetes, high blood pressure, high cholesterol, which means we need to control that side of things. The other part of your question was simply that idea that we want to work on not necessarily thinking that we have a cure-all or anything like that. There are certain occupations that make a higher risk, but it usually has more to do with head trauma than any specific heavy metal. So speaking to the aluminum question. So a lot of times we saw this in steel workers or construction workers. That has more to do with those minor head injuries that can occur. And it leads more to that CTE, or chronic traumatic encephalopathy.
Thank you.
My
Thank
pleasure.
You, Dr. Jobin.
Yeah, my pleasure.
പ്രത്യേക ക്വസ്റ്റ്യൻ ഒന്നുമില്ല വിശ്വസിക്കുന്നു. ജോബിനോട് പറഞ്ഞ സമയമായി 10:30 ആയി. Thank you, Dr. Jobin, for come and give us a nice class today. And I thank you all for the participation. I can see Kuttajangal, I can see a lot of face here. എല്ലാവർക്കും പ്രത്യേകം നന്ദി. താങ്ക് യു. അപ്പോൾ ഫേസ്ബുക്ക് ഒന്ന് ഓഫ് ചെയ്തേ സഞ്ജയ്.
കേട്ടില്ലേ ഇപ്പൊ കേൾക്കാം.
ആ, അതെ.
താങ്ക് യു ജോബിൻ.